Councilman Miller, then Councilman LaFortune, then Councilman Anthony. Okay, Councilman Miller, you have the mic.
Thank you, Mr. President. And yeah, I do want to thank everyone for being here tonight. And I just want to start by also sharing my sincere condolences to Councilman Narducci for the loss of our city sergeant, for the loss of your good friend. We will all miss him, and my condolences go out to his family. I also, just before I start, want to say to you, Councilman Narducci, I would very much love to bring you to Federal Hill to have a dinner on a Friday or Saturday night where there has been a really remarkable, celebration of our city's resilience in the face of some really difficult times. And so, this is the second time you mentioned it, and I would be remiss to not say, come have dinner with us, because it's a pretty good scene on there. So that's it, Colonel Clements. I want to thank you also for these graphs that are up front, and ask you if you could provide those. Somehow those ones that are at the overall crime trends are not in our packets. So if you could please provide those to the council office. It is very heartening, given the very difficult time we've had over the last couple of months, to see that overall trend of both, total crime just going down year after year. And so I would like to have that for the record, so thank you. There's a lot been said tonight. I'm not going to try and reiterate anything. I want to say specifically, when we talk about violent crime, we have an opportunity to bring many more people to this table. And so while I really appreciate your time tonight, and I appreciate you coming to talk to us and to the public, there have got to be more voices, Mr. President, as we talk about solutions to this. Many people around the country, and I think we would be well served by thinking about it this way as well, consider violent crime to be a public health issue. Consider it to be an epidemic, right? And by that I mean, when violent crime starts happening, as it has in Providence, as it has around the country, we see not just one incident, but more incidences, right? And so the way we know something about handling a public health crisis right now, right? The way that we counter that, the way that we engage that, the way that we take it on is by engaging the whole community, is by very much by engaging the people who are at risk of engaging in violence or other behaviors, people who are at risk of recidivism and potentially re-entering the criminal justice system. We do it by straight on engagement, and there's lots of models. So I want to just introduce folks to a model called violence interruption that is well engaged in places around the country. It means exactly what it says, violence interruption. More often than not, it is a non-police response, right? It is alongside other city and police responses, but it is a community-led path to engage directly where violence is happening, where we know that people are at risk. Similar to, I really appreciate Pro Tem Espinal's comments about wanting to make the future better. I think we have an opportunity to make the now better, right? That we're not just talking about the children as much as we do have to engage in these long-term questions and these long-term problems for the kids in our schools. We have an opportunity to engage the people right now who are, and I don't think we come out of this without doing that. And so it's a community leader response, right? It's kind of old school community leader response, right? Where we're engaging community leaders to engage their neighborhoods. And there's lots of ways we can do that at the city level, so models like this have had a huge impact in places like Chicago, right? A community impact in Chicago saw a 50% reduction in gun crimes when using a violence interruption strategy, right? A 50% in a city we know to have a tremendous problem with violence. On the city level, I think that we can provide a backbone, a kind of scaffold of support for initiatives like this, right? I think we can provide, so right now, in our rec centers, I think one of the jewels of the city of Providence is our recreation centers. we don't have a lot of programming. Once you hit 12, you gotta you gotta go join your school team. We don't have a lot of programming, but we have an opportunity to engage young people from 12 to 18, right? Who are hungry for it. And the thing that we haven't really talked a lot about tonight, although we started to allude to it, is in the last, there's something else that's happened in the last 18 months. And that is that as the COVID pandemic took over, the bottom fell out for a lot of people who depended on the social interactions in school, who depended on the social supports they got in school, in our rec centers, in all of these both formal and informal interactions they have in the community. And so, I'm not sure what more we could have done to, given the extreme public health situation we were facing, but I do think that we failed a pretty significant portion of our community that has counted on those interactions for a long time. So all of this to say, I think there is more we can do in this moment right now. I think I would love to have many more conversations about violence interruption strategies and how, as a city, we can support them, and as a community, we can bring those voices to the table to also support. So thank you.
Thank you, Councilwoman Miller.